What are you doing?
Just playing Penguin Evolution, Mom.
Oh, all right. I'll leave you be then.
Oh, stupid Kate! Oh. Mom, come back in here, quick!
What's wrong? Sweetie, what happened?
I fell and I can't stop bleeding!
Do you think you need to go to the hospital?
Yeah, I think so.
A few moments later.
Okay, sweetie, what's the problem here?
When I bleed, it doesn't stop.
Yeah, it hasn't stopped bleeding since the car ride here, and it's been like 20 minutes.
Okay. May I see the cut, please? Well, first I'm gonna clean the cut and wrap it so it will stop bleeding as much. But if you think this whole situation is bigger than just a cut, we can do more tests if you're willing to be asked a few more questions.
A few inches later.
Okay, all wrapped up. Now for some questions. Question number 1. Have you noticed any abnormal bruising on your child in the past years?
Well, I'm not sure. Rick?
Yeah, I've been bruising really easily and I've gotten a bunch of random bruises in the past month or so.
Okay. And have any of these bleeding episodes happened before?
Well, no, not really.
Okay, well, it looks like this is going to take a little longer than I expected because I have a few ideas in mind on what this could be. I'll go run and get you tested right away, if that's okay with you.
What kind of tests?
Well, I'm going to test to see if Rick has hemophilia, and since hemophilia is a blood disease, I'm going to have to draw blood.
One eternity later.
Sorry for the wait, but we have performed a series of DNA tests, family tree tests, and clotting factor tests on your son.
What do these tests do?
They let us know if your son has a genetic disorder called hemophilia, which allows the blood to not clot as well as it should. Unfortunately, Rick does have this disease, which explains the excessive bleeding.
How will this disease affect my son's daily life?
With the right treatment and care, your son can live a pretty normal life. Just watch out from rough activities or sports that may cause more bleeds. You also need to pay closer attention to any minor injuries because they may turn into major bleeds.
How can minor bleeds turn into major bleeds?
Something as small as Rick bending his arm can cause an injury in his blood cell and cause internal bleeding, so you have to take any bruising or swelling around the joints very seriously.
All right, thank you. What if any bleeds happen at school?
It is very advised to tell the school teachers and staff what to do if your son has any bleeds, and it is also important for them to know when to call you and bring your son to the hospital.
Okay, do you think my son will be treated any differently at school?
Rick may need to be more careful in activities at school, such as going to gym class, but there should be no reason that the other students treat him differently.
So, what can we do to help him?
Currently, there is no cure for hemophilia, but there are still treatments we can do to help your son maintain a healthy life.
Such as?
There's a medication called a clotting promoter, which helps the blood clots form to reduce the risk of more bleeding. There are also supportive care options, such as directly giving your son medicine through an IV.
We will certainly have to do more research on these treatments with his father before picking one which we think is best. But thank you so much for providing us with this information.
Yes, no problem. But there are more resources you can go to if needed. There are many support groups you can reach out to online for help on financial and emotional support if you need any.
What are some of these support groups called?
One of these groups is called Hemophilia Illinois. They give patient assistance programs, financial assistance, scholarships, and emotional support.
Thank you. I will definitely look into this with my son and my family.
Do you have any further questions?
Yes. Where did my son get this disease from?
For that, I will recommend you some genetic counselors and have them explain everything you want to know.
Okay, do you know any of these counselors' names in this area?
Yes, Christine Moon, Gina Morley, and Suzanne Stillwell are some of the best genetic counselors around this area.
Okay, thank you. I will definitely contact one of them. So what brings you here?
My son Rick has been diagnosed with hemophilia after he couldn't stop bleeding recently, and we had to take him to the hospital where they tested him for his disease. The doctor said you were one of the best genetic counselors to talk to when I asked about how Rick got the disease.
Well, you have come to the right place. I'll contact your doctor to send over the tests that he had performed on your son, so I can review them and tell you the diagnosis.
Okay, thank you.
I have reviewed these tests, and I have found out that you are a carrier for hemophilia, which explains why your son inherited this disease.
I'm the carrier? What does that mean?
Yes, this means that you had one copy of a hemophilia gene, and so does your son. The father of your son does not have hemophilia, which means the father has 2 normal X and Y chromosomes, and you have 1 hemophilia gene on 1 X chromosome and 1 normal chromosome.
What were the chances of this happening?
Your son had a 50% chance of inheriting this disease since you are the carrier of this hemophilia.